Younger patients may develop symptoms of coronary artery disease for the first time, and this could be fatal as well. They can have a myocardial infarction as early as the age of 20 or 25 or 30, and more often than not, this could be fatal or could damage their heart muscles, leading to left ventricular dysfunction. And we can do a lot about educating this younger population, preventing the disease, and also treating them and bringing them to normal. Diet modulation is the foremost important thing. We can reduce the cholesterol content in the diet, which is the exogenous carbohydrates which we are consuming are refined, and the fat which we are consuming is the saturated fat, or if we reheat the oil again and again, it is the trans fat. Switching over to a mono unsaturated fat or a poly unsaturated fat would avoid the rise of cholesterol, would avoid the bad cholesterol, and also increase the good cholesterol, which is protective to this population. This change of cholesterol is modulated by the genes we have, but also modulated by the lifestyles we practice. And at times the question asked to us is, why me, why my relatives, or why my friend? Friend, the genes harboring in a population may be the same, but the environmental factors, the lifestyle could be bad for a particular group, and this is what produces the acute events. The other point which needs to be understood is that the blockade in the coronary artery, the stenosis percentage in the coronary artery may not truly reflect the event rate which is going to develop. So a sudden stress, a sudden change in the platelet milieu, a sudden change in the internal circulatory system could produce an intense constriction, formation of a thrombus or a clot, and this would culminate into an acute coronary event, even though the percentage stenosis in that particular person may be less than 50%. So 50% of the myocardial infarction would occur in this group of population who have a high sympathetic drive, who have a personality which is very competitive, who want to achieve everything in a short span of time, and also who do not have a social support system or cohesion. And this is precisely in a population which is migrating to the Western society. Our siblings who go outside have no social support and cohesion. They are working in a competitive atmosphere and practicing a bad lifestyle. To add to this misery is a loss or reduction in the physical activities. This low physical activities, low competitive sports, avoiding the outdoor sports, and to take care of emergencies. Add up practicing some meditation, some exercises, which you are literally doing is you are trying to trigger a loaded gun. Genetics unfortunately has given us loaded guns. Our genes may practicing consuming vegetables with different colors. Add vegetables which are white, which are purple, which are lifestyle, buy your food and preventing the curse of disease in these patients. Thank you so much.